The second complaint that I often talk to patients about, they come to me and they say, I love my body. I'm a yoga instructor. I work out every day. But I nursed 3 kids, and my breasts, like I look in the mirror, and where did my breasts go? I had breasts, and now they're gone. They have a deflated appearance. Maybe their nipples are pointing down just a little bit. Or maybe one is slightly bigger than the other, but they don't have any cleavage. That's almost universal. When you have a pregnancy, and your wife is pregnant right now, right? So during pregnancy, the gland inside the breast matures from an immature state, which is before pregnancy, the gland inside the breast is physiologically immature, and it's only at the completion of pregnancy does the gland become mature breast gland. And that gland has a different texture and a different density. So the pre-pregnancy gland is a little bit denser, a little bit thicker, a little firmer, and after pregnancy, the gland softens and matures. With nursing, the breasts get larger and smaller hundreds of times during the course of breastfeeding.
Sure.
And that will also cause a little deflation of the skin. So you develop deflation of the skin, and you develop a natural softening of the gland as the gland matures into adult woman's breast parenchyma. And so you get this deflation in the upper breast, and that's one of the most common complaints. Even the most fit and athletic mom will say, my breasts are empty at the top, I have no cleavage. Or I look good in a bra, and I take off my bra, and I don't like what I see. When I meet with the patient, we'll talk about her concerns. She'll show me what she sees. I listen to the patient. What do you see when you look in the mirror? Show me. And they'll show me, and we'll talk about the deflation in the upper breast. We'll talk about the size that she's looking for, talk about her daily activities. I would never want to do a large augmentation on someone who's planning on being a runner. I wouldn't recommend that, right? It's going to be difficult to do a lot of high-impact activities with very large breasts.
Yeah, makes sense.
I often will ask a patient, when you're in your favorite bra, do you like how you look? When you're in your best bra, is your volume enough? Because for some women who come in and say, I'd like breast implants, what they actually are telling me is, my breasts are deflated, I want to have more fullness. But if they like their fullness in their best bra, then what I could do is just a breast lift and tuck that tissue up. But if upper pole fullness is their main concern, a small implant might be needed in order to develop the upper breast and to get that cleavage that they're looking for. So each patient's own concerns and her individual view of her body is going to dictate the direction that the conversation goes.